A very good evening to you and welcome to this episode of Family Matters. It's glad to have you tuned in. My name is Purity Museo and tonight we have a very candid discussion here on drug and substance abuse. What are some of the commonly abused drugs? Even as NACADA now is indicating that over 4.5 million Kenyans are abusing just one kind of a drug. Tonight we want to put that into perspective, especially how some of these drugs, when abused, how they can affect a family setup. And tonight I'm joined by a team of, let me say, an expert and two survivors who will be helping us know how, especially which drugs they were struggling with and how they were able to come out of the journey. Next to me is Gitali. Gitali is the chair for the Kenya Tobacco Control Alliance, KETCA. He is an expert on matters drug abuse and the guidelines and where we are as a country, where is the gap and why are the numbers increasing. He will be helping us with that. And next to Joe is Faizah Wanjiru. She is a survivor for one of the drugs and she will be telling us which drug she was struggling with and how she was able to overcome that, the rehabilitation journey. And next to Faizah is Isaac, who shares the same story but a different kind of a drug that he was struggling with. They will be speaking with us. Also talk to us on our social media platform at Purity_Museo and at KBC Channel 1. The hashtag to use is Family Matters KBC. Now help me welcome our special guest tonight. Thank you so much for joining us and thank you for accepting to come and talk about this really very sensitive issue that is affecting so many families right now. Joe, allow me to start with you. Why do we have increasing? Every year we get reports on drug use and the numbers are increasing, especially among the young people. Why do we have the increasing trend and which are the commonly abused drugs as at now?
Thank you, Purity. Now, this is a real problem that we have, and as a country, we are supposed to face it. Some of the reasons that make drug abuse to keep on increasing or becoming worse include poverty. There are those who engage in drug peddling, and in the end, they start also abusing the same drugs. But the main intention, when you look at it from the beginning, was to make some money. And the drug traffickers, the barons, the drug barons, they know that this is a cheap way of really making good money. So they have found a way of taking advantage of the joblessness in the country, and therefore they are using young people who would like to get some money for their use, especially in colleges. When you go to our universities, you'll find these two things really going on, drug abuse and sex abuse, whereby the young people who are poor, and yet they are supposed to eat as they pay, because we have eat as you pay. They are supposed to ensure that they dress, they have their daily needs. So
poverty is one of the
that is a bad thing that is really happening there. The other thing is the increased peer influence and reduced parental care. You know, parents no longer really stay with their children to teach them, to guide them, and therefore they are taught by others. And in most cases, children who have been brought up wrongly or the so-called deviants, those with deviant behavior, are normally more active and influential. So they bring in, they easily recruit others into what they are doing. And you see, because of that sense of belonging, those who are together would want to feel the same. You see, you feel out of place if you are not doing what others are doing. Right. So that peer influence, lack of parental care, and the drug barons that want to make cheap money, poverty, you know, all these things, they are making the situation worse time after time.
So which are the commonly abused drugs currently, especially in Kenya?
The most abused drugs include alcohol, though some say alcohol and drugs, but you see alcohol is in itself a drug, because you say a drug is anything, once you take it into the body, changes the way the body is supposed to be functioning. So alcohol is the leading, and this one is at around 12%. And then we have got tobacco, which is at around 8%, although WHO puts it higher at around 12, but NACADA puts it at around 8. Then we also have Mira, and Mira stands at around 4%. And then we have Bang, which is around 1%. So those are the common ones in Kenya, although we have others that when you talk about cocaine, you talk about hashish and all those, but the mostly abused drugs all over the country are the ones that I've mentioned.
Yeah. And Faizah, thank you so much once again for coming to our show and boldly wanting to share your struggle with drug use with Kenyans and everybody who is watching. Now, just of the drugs that Mr. Gitali has mentioned, maybe which one were you struggling with and how did that start?
What I can say, I started it through family rejection, and in addiction there are 7 stages. The first stage,
which drug were you using that time?
So in those stages we have got pre-contact. You want to know what is this, you start using. You come to experimental stage, then you start using. Then you have social stage, then instrumental stage. You are introduced from one drug to another. So I just started with mini packs. During that time, there was this alcohol called, it was a kind of spirit. It was called Sapphire.
Okay.
I started with mini packs. Then I was introduced to cigarettes.
Maybe you can move your mic closer, yes.
Introduced to cigarettes. Then I started chewing mirror. When I started chewing mirror, then I could see that, okay, that was not enough. And then I started smoking bang. I went ahead up to injecting myself using cocaine and heroin.
And maybe at what age were you a teenage, or at what age were you when you started using all these drugs that you were mentioning?
I started at the age of 13 years, and when I was 14 years, I got pregnant. I sold my baby, my unborn baby, for 20,000. I was given 10,000 as down payment. So that's how I become worse and worse on using those drugs.
Okay, Faizah, I'll get back to you. Isaac, thank you also for coming. Maybe you also let us know which drug that you were struggling with, and when did that start, and what was the cause for that drug that you were abusing? Was it one, or it was different kinds, like Faizah is saying?
Okay, so thank you, Purity. Let me say, in my case, it was alcohol. That was the primary substance. That was the main one I was struggling with, and I'll talk of it basically when I was in school. When I reflect back, let me say immediately after my Form 4. That's when I started, I could go out and purchase alcohol on my own. But prior to that, there was also that exposure. You see, even on family occasions, whereby whenever you're having a party, go together, you can have a sip. And then that one, even out of ignorance, you find that even your relatives, your parents can tell you, have a sip, it's not bad. And then eventually you'll graduate into becoming an addict. So on my part, I pursued my education, that is up to university. The moment now I entered university, there's what you normally call a boom. So at that particular time, I had the finances I could be able to purchase or drink on my own. And then it proceeded like that when I was employed, that is by the Teacher Service Commission. I'm a teacher. And then actually it became a problem to me. Question of absenteeism, and then interdiction, and then finally I was dismissed. I've been trying to follow up my case with the Teacher Service Commission, and of late, at least, they are trying to warm up to the idea that also you should not actually condemn the person. They are looking at it from a different angle. This is not as what, let's say, the layman would say that, let me use the common language, a die head. If you want to stop, you can stop. but it has been proved that medically this person has a problem. Just as my colleague has stated various factors which contribute to somebody abusing, you can also look at it from the family part of it, whereby you find that probably what you call X factor, the genetic predisposition. Once you touch a drug, then you become allergic to it. Though you want to stop, you cannot, unless you get assistance. So throughout, up to 2013, that is when now I got assistance through my sister, connected me to Sergeant Kimenchu. Kimenchu aired me on Telly Live. That was back in, I think it's the same channel, Citizen. And then a certain Madam Joyce offered help to me. She sponsored me in a rehab, that is the Bridge Center. And then after doing the 3 months program, because already I didn't have any job, I was like, now I've finished the program and then I'm going back home. Chances of relapsing are very high.
Yeah.
So what do I do? So I requested that they retain me. So from then on up to now, I've been within the center. When I get an opening to teach, I go out and then come back.
Yes.
Yes.
We'll get back to the rehabilitation journey, and especially because you've already indicated you are dismissed from your work because some of the effects that we have. But for you, Faizah, you said that you began taking drugs when you were 13, and then at the age of 14, you conceived. And then maybe you could tell us how did these kind of drugs that you were using, how did they affect you, maybe your health and also your relationship, either in your family or even with your friends?
Okay, let me say, as I have said, that it was through family rejection. And normally when you start using these drugs, some of your family waga wanakuachanisha. If they have a family gathering, they cannot include you because they are saying this one anakuja kutuaibisha, something like that. So you can see even some of them, they are giving you money in order to go away from them, because they don't want to, in that dinner, or maybe they don't want your family to go and start saying that she was drunk, she's like this and this and this. So you are being rejected from the family, and that's something that drove me to become to be an addict. So that was one thing. Then I came to peer pressure. I had some friends who introduced, because I was not having, okay, when I was getting the rejection from the family, then I was introduced, I went to my friends, and those are the ones who introduced me to those kind of drugs. Okay. I ran away from Murang'a, and I came to Nairobi, I started taking those drugs. I have been even a peddler of transferring the cocaine. I have gone to shoplifting, Nakumat, Uchumi, yeah.
Okay, kindly don't mention the names of places because they are not here to tell us whether it's true or not. But I understand your journey. Joe, from what they are saying, they have had different, experiences with the drugs that they're using. Maybe from an expert's point of view, would you let us know what are some of the effects of these drugs? Because you already mentioned that alcohol and tobacco use, they are common in the country right now. How are they negatively impacting our society?
No, these are very seriously addictive substances, especially nicotine, which is found in tobacco. And they have a lot of social economic effects. You find there are many, in fact, as he says, I believe we are talking of joys of TSC. There is a choice the Joyce at the TSC who is in charge of wellness.
Yes.
And we have had meetings with the TSC officials many times and others. And we are saying that addiction is now treated as a disease. It's not the way people used to look at it as something that you are just doing.
In line with that, the Joyce I'm talking about is a different Joyce, not the one of TSC.
So it's now, addiction is actually a disease. So once one is addicted, now it becomes very difficult for them to live. And that means they need resources to sustain themselves, to continue using the drugs. Because these drugs are not just found freely. They must have a source of funding. so as to get the drugs. And that's when some even engage in criminal activities so as to get what they want. And you just heard her say that she was even involved in shoplifting and all that. Because apart from the drugs that she needs, she must get resources to get the drugs. If it's cigarettes, if it's alcohol, there are other needs which they also have. And nobody is willing to provide. They are seen as people that they are social misfits. And therefore, they must also look for how to get food, how to get clothes. And that just means that they should do wrong things because you can't even give them a job. You look at them and say, no, even when you get young people to work for you, you isolate them. So they now look for ways of continuing. And once they are stigmatized, they now become very bad. So that is something that the society should actually look at, that these are people who need help. These are people who should be understood. And when you look at the age at which addiction takes place, you find that it's that vulnerable age of discovery. So by the time these people are now mature, they're already addicted. So they would like to stop what they're doing, but they find it very difficult because of the withdrawal symptoms, because they have been stigmatized and therefore they have developed defense mechanisms by even going deeper into those things to show that they can stand on their own. So it becomes a whole kind of a problem that is very difficult to treat. But as they say, there is a way. If
Yes.
the community can still help even the worst of the addicts. Yeah.
Let's get to the way. Isaac, you just tell us two things. One, how because at some point you are dismissed from your job.
Yes.
How did your addiction to alcohol affect your relationship, especially with your family, your children, if you had them at that particular point? And now take us through rehabilitation journey. How was it like? How did you get help, and what was the process like?
Okay, now when you're talking about family, that immediately I was employed as a young man. I had that, just like any other gentleman starting a family. But then I could not be able to sustain a stable relationship because obviously alcohol. You cannot be able to pay attention to the household demands and all that, even paying attention to your partner. So actually, I did not succeed in having a permanent relationship. Now, when I was dismissed, that was back in 2005. And that was just when I was leaving my youth at 35 years old. That's when I was dismissed. And that is when I was trying to start a family. So now you can get that kind of a picture. You don't have any job. You go home, people reject you. You approach people, and because now addiction has so much gotten into my system, I cannot even be able to function without alcohol itself. Mm-hmm. So what do I do?
Yes. How did you get help? What was the journey like?
Now,
how would you describe that?
That is what you call hitting rock bottom.
Yes.
Because even as she's saying here, even household goods, you'll start selling them. And once you can't find anything, that's when you start those funny, petty crime. Though I didn't reach there, but I was heading there. I had a sister at that particular time. She was working in Muranga. And she actually was aware of this Sergeant Kimenchu, who was rehabilitating addicts. So she presented my case to him. So Kimenchu came all the way up to home. And when he came home, obviously as an addict, there are those denials. I remember very well when he approached me, he told me, young man, I think you have a problem and you need some help. I told him, now who has a problem, me or you? You see, now that's a form of denial. Even you yourself, you're not in your real sense. That's why it's a sickness. But since now, in fact, he tricked me. He told me that there are some people who want to see you and they want to talk about your work, and probably they'll see how you'll go back to work. Now, the meeting was taking place at home. So when I went there, he had organized for members of the press. Now, when I realized that actually I was going on air and I was still shaky, And because I had reached rock bottom, what else did I have to lose? So I said, well and good. I have nothing to lose.
Yes.
So when I was aired, that is when now Madam Joyce saw me. And she sponsored me to the rehab. And because deep inside, yes, I wanted to change. Once I entered there, yes, it was a bit hard fighting the withdrawals and all that. But deep inside, you know that willingness, when you talk of willingness, it's hard to adjust. But if you are willing to put up the fight, eventually you'll stabilize.
Yes. And I'll come back to you and
Yeah.
you'll tell us what exactly happens in the rehabilitation center, because at some point you're trying to not to take alcohol, but you cannot resist. But then how did you what exactly happened that changed you completely, that right now you're not taking alcohol? But before that, Faizah, let me get back to you. He mentioned how he struggled coming up with a family or even a stable relationship. Did maybe abuse of the different kinds of drugs that you've said affected your relationships, especially? Did you have problems with coming up with a family? Do you have a family or even a relationship? How was your relationship life like at that particular point? And maybe if you don't mind, do you now have a family?
Okay, my relationship life, when I got pregnant, the guy who made me pregnant, he was not ready for marriage. So he dumped me, and that's why I decided to say, okay, I needed to kill myself or maybe have an abortion. But my friends told me, no, there is a woman who she doesn't have a child. She wants to buy a child, so you can sell the child. So I sold my baby, unborn baby, for 20,000, and was given 10,000 as down payment. Pretty while I was taking money, I had nowhere to keep the child because we were living so many. The other thing, I needed money to buy drugs and to sustain drugs, because normally you see me loitering in town. I ran away from home. So it was a big challenge.
So how did you get help?
Okay. After I have gone, even I lived in the streets, I have gone to Zambia. I came back to Kenya and I started abusing drugs. That's why I got, you can see my arms. When I injected myself, let me say niliangukaga kwa moto, and I was admitted at Kenyatta. I have been abusing drugs for almost 17 years, until 2015, when the president said that the illicit brew and the drugs, he banned them. And in Murang'a, during that time I've gone back to Murang'a, and during that time we started having withdrawals because we couldn't have money to us. Imagine I could have been having 1,000 shillings, 500 is to buy for alcohol, 200 is for mirror, 150 is for smoking ban, the other one is for cigarettes, and I could eat food of only 20 shillings. I didn't care even the child. So during that time, the governor Mongiwairia, he started a rehabilitation center at Yura Stadium. That when Sergeant Kemenchu came, and he told me that he is starting his own bar in Kagema, and he had seen that he has been told that I'm very good at service. And I agreed. And during that time, I was so drunk. So I entered into his car and we drove off, not knowing that he was taking me to rehabilitation center. So I was taken to Hura Stadium. I didn't know where I was. He was wearing civilian. He told me let me go and correct the keys. When he came back, he came wearing full uniform. That's why I started telling him, please don't arrest me. He told me that I'm going to arrest what is inside you. During that time, I was screened at the rehabilitation center, and my journey started there. But it was not so that easy.
Okay, we'll get back to what exactly happens inside there. But Joe, you mentioned that addiction is not really, it's a disease and should be treated as a disease. Are we doing enough as a nation to help? Because as at now, we have so many cases of people abusing different kinds of drugs that you've mentioned. Are we doing okay as a nation in helping these people who are struggling with drugs, and what ought to be done? I understand there are guidelines already in place, and the government, I must say, is doing something, especially on the Tobacco Control Board. Maybe just tell us, how are we faring on as a nation?
As a nation, we've not done so well, especially in the past, but we've started now becoming very sensitive to this. And that's why we have guidelines on cessation. And then the level 5 hospitals and those referral hospitals in counties are now being equipped so that people can go there for help. You know, it has been difficult getting experts in this area, people who can help the addicts. So one would like to quit, but there is a problem. But now every county is supposed to have to provide rehabilitation services. So this one is being taken very seriously, especially by the Minister of Health. And I'm sure, as we are talking, there is a program whereby rehabilitation centers are going to be established in the country in selected counties. The problem has been in the past that these rehabilitation centers have majorly just focused on alcohol and then things like bang, cocaine, and not tobacco. Such that there are those who even say they go there, they went to rehabilitation centers as alcoholics. Then he left having stopped drinking but started smoking, because now smoking was not being taken very seriously. But now everyone knows that this is even worse than being an alcoholic when it comes to tobacco. It is the worst of even the things we are talking about. So the rehabilitation centers are now going to be comprehensively managed so that all the conditions of addiction are taken care of. We are still behind in capacity. The capacity of that's the personnel, we don't have enough. And that's why even you can have a facility, but without the right personnel, the facility will still serve no purpose.
Yeah, and some of these drugs that you mentioned are still not illegal. What should we do as a nation to curb this problem? Like, for example, when you talk about alcohol, it's not illegal yet, but some of the effects, they're really permanent effect that come, with alcohol use. So what do we need to do to curb all these increasing cases, apart from guidelines, in specific guidelines, and apart from rehabilitation centers? Do we need to go ahead and now begin illegalizing all these drugs that are harmful to our bodies?
There are those that have been declared illegal, like for example, shisha has been banned, although it's still being consumed secretly in some parts. Shisha is basically tobacco, but it is worse because of the volume involved and how it is consumed and all that. So that one is one. When we ban certain substances like those ones, then we should have really regulations enforced. We should have these policies that will ensure that demand is reduced, supply is reduced, and that minors are not involved. Because, as we have said, initiation is done at that level when people are still adolescents, when they are still discovering. So if you take charge of that, if you take care of the adolescents, you take care of children, then obviously you will be killing the problem. So that's what must be done, because we know in every case, prevention is better than cure. So that's why we want even a lot of content on drug abuse to be put in the school curriculum. And this is being done especially with tobacco control. We have negotiated, and the Minister of Health together with the Kenya Institute of Curriculum Development are working on a program, or rather on a way of ensuring that this content runs from pre-primary up to the highest, from the lowest level to the highest level, including university. And then we are increasing research at the university level, and we want these policies also enforced in our institutions of learning. Mostly we talk of these policies and then they just apply outside there. Universities and other colleges continue violating the policies. So if people are educated, there is nothing as powerful as education. If people are empowered, they get this education from the lowest level to the highest level in every area, not just in schools, but even informally. We are saying even in churches, mosques, leaders in the villages, everyone should be involved. And that's why we are there doing the same as KETCA and other organizations, reaching the grassroots, finding people where they are, and helping them. You have heard them talk about what is being done, that they are even tricked and they've discovered that they have been taken into rehabilitation center, and you can see the result. Yeah. So these are some of the things we want to be done. We are encouraging that more and more is done. Our only problem, as we have always complained, is that very little resources are allocated when it comes to these, the so-called the NCDs, non-communicable diseases. And you know, addiction is one of them. Mental health. See, we need more resources to be allocated, especially when it comes to the Minister of Health, that department of NCDs, that one of environmental health, which formerly we used to call it public health, so that people can prevent these things before they get involved into them. And that would be the surest way of arresting it. Otherwise, we cannot illegalize. We cannot say we away with the tobacco, away with the alcohol, because Munyonge hana haki. We are the people who keep following what is being done in developed countries. So Kenya cannot stand up and say we have banned this when Britain has not, when US has not. We will be told, no, you are joking. So don't visit our countries. They'll ban the president from visiting those countries. And that's, it will not look good.
Okay.
So, yeah.
All right, let me, Isaac, come to you. So many people are afraid of going to rehabilitation centers because they believe only crazy people. They say, I'm not crazy, so I cannot go to a rehab center. Tell us what exactly happens, especially for your case. You were addicted to alcohol, but today you don't use alcohol anymore. What exactly, what is the journey inside there? What sort of, is it a treatment journey that you are really exposed to, or what exactly happens there? And would you encourage someone who is really struggling with the same, struggle as you had, visit a rehabilitation center? Yes. Okay,
I'll be brief on that.
Yeah.
Let me say, even before you enter into a rehab, there are these three main principles, which, as he says, the public also ought to be educated on. This is the question of willingness, honesty, and open-mindedness. When you force somebody into a rehab, the chances of him actually following up the program, let me say, will be slightly 60% somewhere there. Then there is that honesty. You yourself, do you accept the kind of life that you have, the problems that you have? And then being open-minded. The question of probably you fixated your mind about this. Can you be flexible? Can you probably try another thing to solve your problem? Now, as you mentioned, it is a treatment journey. Once you enter there is what you call detoxification. And then there are medications which are given to counter the withdrawals. Then from there is the breaking part of the denials. Then you come to know yourself. It is a 12-step journey. If I can jump, there is the most important step 4, inventory taking, whereby you search yourself, know who you are, know your weaknesses, know your strengths, and then know how you can be stable. And then once you finish that one, there is what you call the relapse part of it. Once you come out of the rehab, even if you're not going back to employment, what are you going to do to avoid going back to the state that you're in? So those people who are facing that problem, if they are honest to themselves, and they admit that they have a problem, and they want to change, then that is the best way to go, rehab. Yes. Because once you're out, then you'll be stable and you'll know yourself.
And on that note, let me ask you to finally speak with people, because for you it was addiction on use of alcohol.
Yeah.
There are so many people using, they cannot control themselves because it's an addiction. As much as the society is trying to condemn them and why can't you stop 1, 2, 3, and 4, but it's an addiction. Maybe someone who is using alcohol and maybe they're not addicted or they cannot stop, would you speak with them?
No, it's probably now. There are those people, as I said earlier on, there are people who are allergic to alcohol. There are people who take it, but it's not a problem to them. But there are people who take, it affects them, but they're in denials. Like earlier on, even in this program, there is that test which normally is given, the cage test. C standing for cat, A for anger, G for guilt, and E for eye opener. Now, if you have tried to stop or cut your taking and you are unable, or if you are angry when people talk about your using, or you feel guilty after taking, or you need, as I had said earlier on, I was actually not drinking to get drunk, I was drinking to be stable. You need an eye opener. You need to kutoa lock. If you just say yes to one of them, you have a problem. And if you have a problem, then seek help.
All right.
Yeah.
If you have a problem, seek help.
Yes.
Faizah, as we wind up, would you say you are proud of the woman you have become right now after going through the rehabilitation center process, because you're the one who understands how you were like before right now? What would you say? Are you proud of the journey that you went, the transformation journey that you went through? And would you speak to young girls and women out there who are still maybe trying out some of these kind of drugs?
Purity, as I go back, what we normally say, we say that addiction is only a disease that someone cannot believe or say that he or she has a disease. And there are so many defense mechanisms that so many people use, like the one I was using. Like someone who is taking alcohol, you'll find him or she telling you that, was it your money I was using? Maybe you are changing the subject. Maybe others who smoke the weed, you can see them saying that they don't believe in God, they don't believe in Allah, they believe in Jah. So those are some of defense mechanisms that people nowadays are using. But you cannot help yourself. What you can do, as the way I did, I just made and I started having the calculation. Okay, how many cigarettes was I smoking per day? Maybe in a packet. And that packet, one stick is 10 shillings, and the packet has got 20 cigarettes. So those are 200 per day. 200 per day per week is 1,400 per month, 6,000 per year. You see, it's 72,000. And let us assume that we have smoked for 5 years. Those are 360,000. I made that calculation, and for youths and for the people who are hearing me or those who are seeing me talking like that, you can calculate, you can see the money you are using. Let's come to alcohol. Maybe you are taking a cup of keg. Maybe you are taking 4 each and every day. Those then are 360,000. That is a lot of money that it can save you, and you can start you can have a family. For myself, I have had 2 marriages, and I've been breaking them because I couldn't bear a child. Why? The drugs those I was using, ziliniharibu kabisa, and I couldn't bear a child. So I am regretting. I started just like Alicia, but now it has become a regret. Yeah. So what I can advise people, one thing, they should have mentors. They should choose friends who can add value to their lives. Then they should focus on whatever they are doing. And how they can focus is, let us say, for the word smart. For us, you are saying they should be specific. Be specific for what you are doing. M, be measurable. A, be achievable. R, be realistic. T, know about your time bound.
All right. Thank you so much, Faizah, for that insight and help to people watching out there. Sir, we don't have time as Kenya Tobacco Control Alliance, but your camera may be parting shot, please.
Thank you. I would want to especially thank the Cabinet Secretary for Health for what she's now doing. She integrated the Tobacco Control Board, and the Ministry is also very eager and moving on with the ratification of the protocol on elimination of illicit trade in tobacco products. And then we are praying that very soon, as she's working, We have the operationalization of the Tobacco Control Fund. We also are happy because they regularized, she led the team to regularize the shisha ban. So we are praying that this will continue. And we ask the ministry also, and the entire government, even especially the ministry that is concerned with the interior and coordination of government activities, that these new products, tobacco products that are coming into the country that are being really promoted, the so-called the ENDS, the smokeless tobacco and all that, the vapes, must really be checked. There are bad things that are luring the youth into starting to use them, and then when they are addicted, they'll continue to use other forms of tobacco products. So those who are bringing them are saying they are safer, but they know that there are hooks that are meant to hook the youth, and then after that they'll continue with their products. So together we should help our country make a contribution so that Kenya is a tobacco-free country, Kenya is a drug-free country.
All right, Mr. Gitali, Ms. Faizah and Isaac, thank you so much for making time for us and for sharing with us your struggles and also how you were able to survive that, and also for the insights, especially where we are and what we ought to do to control the increasing numbers of people, especially the young ones who are using drugs. Thank you all for coming. I'm looking forward to hosting you once again on Family Matters.
You're welcome.
All right, and thank you all for watching. That's all the time we had for Family Matters tonight. My name is Purity Museo. Do enjoy the rest of the viewing, and God bless.